Good morning, everyone, and thank you for being here today. I'm excited to introduce our presentation on DVT, or deep vein thrombosis. My name is Dr. Kashish Singh, and I'm pleased to have the opportunity to discuss this important medical condition with you. In this session, we will explore what DVT is, its causes, symptoms, and ways to prevent and manage it. So let's get started and dive into the topic. Deep vein thrombosis, or DVT, means that a blood clot or thrombus forms in the deep veins, which are usually located in the legs. Now, these deep veins are the large blood vessels responsible for carrying blood back to the heart. When blood flow doesn't move properly, maybe because of immobility or other factors, it can start to clot and block the vein. This blockage is serious because it can lead to a life-threatening condition called pulmonary embolism, where the clot travels to the lungs. So, understanding what DVT is and how it affects the body is crucial in recognizing the risks and preventing severe complications. So why does deep vein thrombosis, or DVT, happen? Well, it all ties back to virtue triad, which explains the three main reasons behind clot formation. First, we have slow or no movement of blood . This often occurs during long periods of immobility, like when you're on bed rest, sitting for hours, or even during an extended stay in the ICU. When blood isn't moving efficiently, it's more likely to clot. Next, there's damage to the vein wall . This can happen due to injury, surgery, or fractures, anything that causes trauma to the blood vessel lining. When the vein wall gets damaged, it triggers the clotting process as part of the body's healing response, but sometimes this process gets out of control. And finally, blood becomes thicker . Factors like smoking, dehydration, cancer, and pregnancy all contribute to increasing blood viscosity. Thicker blood flows more sluggishly and is more prone to clotting. All these factors, slow blood flow, vessel injury, and thicker blood, interact and increase the risk of DVT. That's why understanding Virchow's triad helps us see how these elements collectively contribute to clot formation and why some individuals are more at risk than others. Today, I want to focus on the signs that mostly affect one leg when someone has deep vein thrombosis, or DVT. You might notice swelling in the affected leg, which is often quite noticeable. Another key symptom is pain, especially in the calf area, which tends to worsen with walking or activity. You might also feel warmth over the affected area, indicating inflammation. Redness or discoloration of the skin can also occur, making the leg look different from the healthy side. Many people describe a feeling of heaviness or tightness in the affected leg, which can be quite uncomfortable. All of these symptoms together are important clues that suggest a DVT might be present. Recognizing these signs early is crucial because, as part of our overall discussion, timely diagnosis and treatment can prevent serious complications. So, if you or someone you know experiences these symptoms, especially in one leg, it's important to seek medical attention promptly. If a clot breaks free and travels to the lungs, it can cause a range of serious symptoms. You might experience sudden breathlessness, which can be quite alarming. Chest pain is also common, often sharp and worsening with deep breaths. Some people may cough up blood, indicating that the clot is affecting the lung tissue. In more severe cases, the person could collapse or faint due to the sudden drop in oxygen levels. One of the most serious complications from this situation is pulmonary embolism, which can be life-threatening. It's really important to recognize these symptoms early, as prompt treatment can make a big difference in outcomes. This highlights how dangerous blood clots can be when they reach the lungs, and why understanding this process is crucial in managing risks. When doctors suspect a deep vein thrombosis, or DVT, they rely on specific diagnostic tools to confirm the presence of a blood clot. One of the most common and effective methods is Doppler ultrasound. This technique uses sound waves to create images of blood flow in the veins, helping to visualize any blockages or abnormalities. It's non-invasive and provides real-time information, making it a crucial step in the diagnosis process. In addition to imaging, blood tests like the D-dimer test are often used. This test measures a substance that is released when a blood clot is broken down in the body. Elevated levels can suggest the presence of a clot, but it's important to remember that D-dimer results are not specific. They can be high in other conditions as well. Together, these diagnostic tools, Doppler ultrasound and blood tests, help doctors accurately confirm or rule out DVT. This accurate diagnosis is essential for guiding effective treatment and preventing serious complications. So, understanding these key diagnostic steps is fundamental to managing DVT effectively. Now, let's talk about some key components of treatment that are essential for patient recovery. First, blood thinners, or anticoagulants, play a crucial role in preventing blood clots from forming or getting larger. They are typically prescribed to reduce the risk of complications like deep vein thrombosis or pulmonary embolism. Next, compression stockings are often used to promote healthy blood flow in the legs. These help prevent swelling and reduce the chance of clot formation by providing gentle pressure. Early mobilization is also vital. Under the supervision of a physiotherapist, getting patients up and moving as soon as it's safe can significantly improve outcomes. Movement helps maintain circulation, prevents muscle atrophy, and accelerates recovery. All these strategies together form a comprehensive approach to treatment, aiming to reduce complications and promote faster, safer healing. They highlight the importance of a proactive, multidisciplinary approach in managing patient care effectively. Let's talk about some key prevention strategies to avoid complications after surgery or immobilization. First, early mobilization is crucial. This includes sitting at the edge of the bed, performing bed mobility exercises, and gradually progressing to standing and ambulation. These activities help maintain blood flow in the legs, reducing the risk of blood clots. Next, leg exercises like ankle pumps, heel slides, and active range of motion movements for the hip and knee are essential. They stimulate venous return, which helps keep blood flowing back to the heart and prevents pooling in the legs. Breathing exercises, particularly diaphragmatic breathing, are also important. They not only prevent pulmonary complications like pneumonia, but also improve circulation, supporting overall recovery. Compression methods, such as compression stockings or devices, are used to prevent venous pooling. They promote blood flow and reduce swelling. Finally, elevating the legs helps reduce swelling and lowers venous pressure. Combining these strategies creates a comprehensive approach to preventing complications and supporting patient recovery. Let's clarify some common myths about DVT and set the record straight with the facts. First, many people think DVT only affects older adults or those who are inactive. But the truth is, anyone can get DVT, young, active individuals, athletes included, especially after events like injuries, dehydration, or prolonged travel or immobility. Another myth is that DVT isn't a big deal and usually goes away on its own. Actually, DVT is a serious condition and can be life-threatening, particularly if the clot breaks off and travels to the lungs, causing a pulmonary embolism. And some believe that birth control pills are the main cause of DVT in women. While hormonal contraceptives do increase the risk, pregnancy and childbirth also raise the risk, and many other factors contribute as well. So, it's important to understand that DVT isn't just about age or lifestyle. It's a serious condition that everyone should be aware of.